The last section we will cover is the steps included when we discontinue restraints. Discontinuing restraints has 3 steps that should be addressed. Discontinue restraint documentation, the DC restraint order, and modifying the IPOC. In step 7, we will cover the restraint discontinue documentation. This should include documentation of the restraint episode as discontinue episode, and inactivating each dynamic group label. In one chart, the restraint discontinue documentation can be accessed via the Restraint Monitoring Nonviolent Behavior task from Care Compass. Click on the task, click Document. Within the task documentation, once again, ensure the correct time is reflected in the time column. If not, utilize the blue barrel icon to change the time restraints were removed. Only 2 things need documented. First is the restraint episode activity type as discontinue episode. And then lastly, for every label created for each limb that was restrained, you will right-click and inactivate that label. And click the green check to sign your documentation. The second step when you're discontinuing restraints off your patient is to discontinue the restraint order. You only need to discontinue the initial phase of the power plan, restraint for nonviolent behavior. In one chart, with the patient charts open, from the left table of contents, we're going to click on the orders. Then within the orders panel, we will locate the power plan, restraint for nonviolent behavior. On the initial phase, restraint for nonviolent behavior, right-click and select discontinue, filling in the physician's name that you received the orders from. This will stop the every 2-hour tasking and remove the patient from the restraint report. Next, click Orders for Signature, Sign, and refresh. The last step when discontinuing restraints is to modify the interdisciplinary plan of care. Within one chart, once again on the Orders tab, in the Orders View panel, under Interdisciplinary Plans of Care, locate the Risk for Injury IPOC. Click on this IPOC to select it. If it is appropriate to discontinue the entire IPOC, then we will right-click on the IPOC and select Discontinue. However, if you only want to remove the specific goal without injury while restraints in use, we will locate that goal, left-click on it, then right-click and select Discontinue. Then click Sign. This concludes the video tutorial on the nonviolent restraint process.